Good morning. Good morning. I'm Councilwoman Felicia Porter, representing the 10th District and chairperson for the Public Health and Environment Committee. This is just a reminder, please mute or turn off your cell phones so that they don't go off during the hearing. Joining us today, we have committee members, Councilman Mark Conway.
Thank you, Madam Chair.
Councilman Ryan Dorsey.
Thank you, Madam Chair.
Councilman Mark Parker.
Thank you, Madam Chair.
And Councilwoman Odette Ramos.
Thank you, Madam Chair.
And we also have Tanor Schnella from the mayor's office, and we have several representatives from the mayor's offices and also the city council president's offices as well. Committee staff person is Marguerite Curran. Today on the agenda, we are discussing Council Resolution 25-005R, informational hearing, availability of naloxones in public buildings, for the purpose of requiring the city administrator, the commissioner of the Baltimore Health Department, and the Department of General Services to appear before the city council to present an assessment of the city's readiness to comply with the provisions of Chapter 764 of the Acts of the Maryland General Assembly of 2024.
Madam Chair, sorry. I just got a note that the hearing is muted. So you might gotta start over.
All right, start over. Well, it's good. Good morning. I am Councilwoman Felicia Porter, thank you, Tylor, representing the 10th District and chairperson of the Public Health and Environment Committee. Just as a reminder, please mute or turn off your cell phones so that you don't interrupt the hearing. Joining us today, we have committee members, Councilman Mark Conway.
Thank you, Madam Chair.
Councilman Ryan Dorsey.
Thanks again, Madam Chair.
Councilman Mark Parker.
Thank you, Madam Chair.
And then Councilwoman Odette Ramos.
Thank you, Madam Chair.
We also have Mr. Tylor Schnella from the mayor's office and several representatives from the mayor's offices as well, and the city council president's office represented here today. And we also are staffed by our committee staff person, Marguerite Curran. On today's agenda, we are discussing Council Resolution 25-000R, informational hearing, the availability of naloxone in public buildings, for the purpose of requiring the city administrator, commissioner of the Baltimore Health Department, and the Department of General Services to appear before the city council to present an assessment of the city's readiness to comply with the provisions of Chapter 764 of the Acts of the Maryland General Assembly of 2024, emergency services, automated external defibrillator and naloxone co-location initiative, requirements for public building, by updating its health and safety protocols for all city buildings. I'll turn it over to the bill's sponsor, Councilman Mark Conway, for any opening remarks.
Thank you, Madam Chair. As you stated earlier, we're here today to continue the hard work of saving lives and what we know is one of Baltimore's deadliest public health crises. Naloxone is one of the most effective tools that we have at the ready, and it has the ability to turn tragedy to triumph and a second chance. Today we'll learn a little bit more about the city's plan to comply with Bill 1099 passed in 2024 that would require co-location of naloxone with AEDs within public buildings. This was an idea that I stumbled upon and found out that the state already requires it, and so wanted to figure out what it took for us as a city to come into compliance as quickly as possible, and how we would think about maintaining that stock, updating that stock, letting people know that that stock is available when it is available, and all other various considerations that go in line with staying in line with the state law. So thank you, Madam Chair, for taking the time to address this today. This is part of a duo bill. The other bill will be on buprenorphine, which we'll hear next month. But these are some of the steps that I think will be really important in making sure that we give people the equipment necessary to combat the opioid epidemic. So thank you.
Thank you so much, Councilman. Now, in the normal fashion, we'll go to public testimony. If anyone wants to sign up, you have 2 minutes to publicly testify for this bill. Any person wishing to testify this morning? Any person wishing to testify this morning? All right, hearing and seeing none, we'll go over to agency reports. Department of General Services.
Tyler Shanella, Mayor's Office of Government Relations. The Department of General Services is favorable on the resolution.
Thank you. Health Department?
Good morning, Dr. Michelle Taylor, Commissioner of Health, Baltimore City Health Department. We stand by our favorable agency report and look forward to your questions.
Thank you so much, Dr. Taylor, and finally, welcome. Department of Finance?
Good morning, Benjamin Brosh, Department of Finance. We have a favorable report as well. Thank you.
Thank you so much. Next, colleagues, we'll turn to questions from committee members. As a reminder, you will have 2 questions. We'll do a first round. Oh, excuse me. Sure. Before we go into questions, Mr. Tyler Snella would like to provide some brief remarks on the bill.
Thank you, Madam Chair. Good morning, Madam Chair and members of the committee, and thank you for the opportunity to provide just a little bit of clarity on Baltimore City's role in the availability of naloxone in public buildings. As the sponsor mentioned, in 2024, the General Assembly passed Senate Bill 1099. The law expands the state's public access to AED defibrillator program, as well as the co-location of naloxone. And the purpose of the law is to ensure that up to 2 doses of naloxone are placed alongside AEDs in certain public buildings to allow for life-saving measures in emergencies. Both the city's law department and the Maryland Association of Counties have reviewed the law and concluded that responsibility for implementation rests with the state of Maryland, specifically the EMS board in partnership with the Maryland Department of Health, not with Baltimore City or other local governments. The program is funded exclusively with state opioid restitution fund dollars, not city resources. The state estimates cost at $25 per site for storage and packaging, and $45 for a 2-dose naloxone kit, with replacement required at least every 3 years or sooner if used. Building owners or operators and individuals who administer naloxone under the program are granted immunity from civil liability so long as they comply with the requirements of the state program. The law also applies narrowly to public transportation stations supported by public funds, public gathering spaces such as parks and recreation centers, and public secondary schools and institutions of higher education. It does not extend to every city-owned building. And the state has until October 1st, 2027 to complete implementation. So I do just want to stress to the committee, which I've already talked to the chair and the sponsor, that Baltimore City is not behind on implementation here. Every jurisdiction across the state is awaiting the state's regulations and the full rollout of the initiative. At this time, we're waiting for MDH and the EMS board on the regulations that will govern the inspections, maintenance, and prioritization of the sites. And until those regulations are finalized, none of the state's jurisdictions have any formal obligations here. But from our partners at MACO, we do understand that MIMS and the Maryland Office of Overdose Response are preparing to begin implementation. The transfer of funds to MIMS is imminent, and MDH has already ordered the naloxone supply that they would need. While the state is responsible for implementation, Baltimore City has not stood idle here. We have already expanded naloxone access in our facilities. All 22 city pools operated by Recreation and Parks are equipped with AEDs and naloxone, and all pool staff have been trained by our health department in naloxone administration. All 44 fire department buildings are equipped with both AEDs and naloxone, and every police officer in our city is personally equipped with naloxone. Currently, there are 7 AEDs at the police department headquarters and 3 in the annex. At this time, they're not co-located with naloxone, but obviously as we work with the state, we will determine if our police headquarters will fall on that list of sites that they'll prioritize for co-location. It is also important to just clarify that the Department of General Services does not own, manage, or maintain every city or quasi-agency building. Most agencies are responsible for their own facilities, but again, the administration will be working with the Maryland Office of Overdose Response to obtain the list of Baltimore City locations where naloxone will be co-located with AEDs under the state's initiatives, And as I've shared with the chair and the sponsor, once we get that, it's fine for us to share that list with the committee, just so that you all have that for your awareness as well. And just to summarize where we are, this is a state-led, state-funded initiative. The state has not yet finalized regulations, but is preparing to launch implementation. All jurisdictions, including Baltimore City, are awaiting that process. But in the meantime, we've already taken our own proactive steps. And the city of Baltimore stands ready to work with MIMS, MDH, and the Maryland Office of Overdose Response to ensure full and successful implementation of this initiative. Thank you, Madam Chair.
Thank you so much, Mr. Schnella. All right, we'll now go to questions from the committee members. We'll start with 2 questions each. Colleagues, as a reminder, Councilman Conway, you have any questions, sir?
Yes, of course I do. Thank you, Tyler, for kind of walking through all those pieces. I think this is a really, really important opportunity for the city to sort of lead and leveraging the data that we have, leveraging the relationships that we have, leveraging all the knowledge that we have about how the city works to play a really important role in maybe even being proactive in recommendations to the state that these should be prioritized. I'll also say this, I have personally been in instances, at least twice, in front of my district office where people have overdosed and we didn't have naloxone in the building. And so there were two thoughts that came to mind and things that I think we should be considering as a city. One, just of course, what buildings, and that's pretty obvious. I think 2, making sure people know how to use it and know where it is. The bill, the state bill requires like easily identifiable signage, which is, I think, really, really helpful. A lot of people are not used to knowing that naloxone is next to AEDs. And I'm sorry, this is not really a question. I'm kind of going on this issue. But what I would hope to see from the city is an effort to lean in wholeheartedly into this effort. The recommendation by the state, I think it's a really good bill, a really good law. I wish we'd come up with the idea first, but now that it is state law, I think we can do it better than everybody else. And so I think there's an opportunity for training. There's an opportunity for prioritization. I don't think we should, I know it's the state requiring state agencies to prioritize and so on and so forth, but I do believe there's a real opportunity for us to lead in this effort. And so, I'm sort of asking for that leadership and certainly partnership with the state in the implementation of this so that it works well. The questions that I have here, to that point, I asked a number of questions in advance in preparation for the hearing. One was, how many city buildings do we have?
Yeah, it's about 200 plus.
Okay.
Yeah.
And do we have an estimate of, we gave an estimate for cost. You said about $45 for the 2 doses at every AED location, or?
Well, that's what the state and the fiscal and policy note on the bill, that's what the state estimates the cost to them will be.
Got it.
Yeah.
One of the things that is going to be on the city is going to be the updating piece. So every 3 years, updating the dosage, or if it is used in an emergency, knowing to replace it. Have we thought much about how we want to prioritize that?
Well, and to the point that I raised in the earlier part of my remarks is that I'm sure that is what will be covered in the regulations. Because it is a state program, there's likely will be a way for us to notify them that a dose has been administered, and that site will be like no longer in compliance because the state law requires 2 doses, that there be a process for them to replace the dose that was used. So that is certainly a question that I can take back to Director Thimilis and make sure that we pose that question to MACO and Maryland Office of Overdose Response and get a response to that.
Yeah, I think there might be an opportunity here, whether it's with the health department and having some sort of storage of naloxone available to restock buildings when dosages are used, so that we don't have to ask the state for a $25 piece of medication. That might be silly, but to have that, some backup on hand, is I think a really good idea. The other question I had, I guess we don't have maybe we know today, how many buildings today are compliant with this law?
If I'm not mistaken, there are about 30 buildings where AEDs, and this is DGS covered facilities, right, Leslie? Yeah. Leslie, you want to just come up and take that one? Yeah. Leslie will come up and answer the DGS part of it.
And ma'am, if you can state your name for the record.
Absolutely, ma'am. Leslie Carter, Assistant Deputy Director with Legislative and External Affairs for DGS. I'm here on behalf of our director, he's at BOE. So at this point in time, we have approximately 33 buildings that are in compliance at this point in time. They're not all, and that is including the police department.
Got it. Would you be able to provide a list of those buildings and the locations?
Absolutely.
Yeah, that'd be really helpful. Madam Chair, I'll come back around with more questions. Thank you.
Thank you. Councilwoman Ramos?
Thank you, Madam Chair, and thank to the sponsor to bring this to us. Mr. Schnella, you said that there are the 22 pools that are currently compliant, and then there would be another 10 or so that we'll get the list for. So my question is the priority on the state side to just do public-facing buildings, or are we making sure, I mean, we're trying to make sure that public-facing buildings have all this now, and then we do sort of like, you know, the fifth floor of the council, you know, we don't have a lot of public there. Is that how we're planning on implementing, and do you think that's what the state's working on too?
Yeah, so I don't want to speak for them, which is why we want to pose the question back to them is how are they prioritizing the different buildings, and what is the rollout going to look like? And that is something that I can just, again, add to our list to follow up with MACO and the Maryland Office of Overdose Response.
I would imagine that the public-facing buildings would be the first
right,
ones,
yeah.
but it would be helpful to kind of know that. And then the second question is, what's the timeline that the state has given for their, to roll out the regulations? As we know from previous conversations, right, Madam Chair, we've had some challenges with state regulations coming out in a timely manner, and obviously this is an emergent situation. I guess as a part two to that question, are we gonna be proactive in sending them some of our suggestions for how to move forward?
Yeah, so on timeline for regulations, I don't have it at this moment. I can add it to what we follow up with them on. I think the last update we got was that they were working on the regulations. And in terms of providing the state with a list of buildings that we think they should prioritize, that is certainly something that I could take back to the city administrator so that we can work with the city agencies to identify some locations that we could suggest to the state.
Yeah, and other regulations that you would like to see in the regulations in terms of how we would want to implement our program, and then say, please consider this in your regulations. So being a little bit more proactive rather than waiting for theirs, and then you have a 30-day time period to comment, you know what I mean? So if we can put something like that in place and maybe work with the mayor's office and the committee on something to send over to them proactively, I think that would send a strong message that, you know, Baltimore's ready to do this.
Okay. Absolutely.
Great, thank you. Is that all right, Madam Chair? You want to move in that direction?
Sure, that's totally fine with me. And just to clarify, the COMAR regulations for 1063 are slated to be completed this fall. So they said late fall 2025. And so that's kind of where we're,
Is it the same set of regulations that we're talking about in the previous hearing?
I believe so, yes, 1063.
Okay, all right, great. Great, thank you very much. Thank you, Madam Chair.
Councilman Dorsey?
Thank you. I don't think I have any questions.
Thank you so much, Councilman. Councilman Parker?
Thank you, Madam Chair. Tyler, without asking you to speculate too much as to what the regulations will look like, from your read of the legislation proper or any conversation you've had so far, do we have some sense of the likely distinctions between buildings that will be included and not included in what they and where they want to see the co-location of the AEDs and the? Like,
Yeah.
what criteria are they using?
So for the regulations, if for the committee, if you go back and look at the fiscal and the policy note on the bill, it says that the regulations will really govern inspection, maintenance, and the prioritization of sites.
Right.
So because they don't have the regulations yet, that's what they're going to use to inform how they prioritize buildings and where. But my thought would be that, to the point that the sponsor and Councilwoman Ramos made, it would likely be those buildings that are publicly accessible to the public. Well, obviously that's what publicly accessible means, but yeah,
I appreciate that.
yeah, public facing.
Yeah. Thank you, Tyler. Thank you, Madam Chair.
Thank you so much. Councilman Conway?
Thank you, Madam Chair. One of the other questions I requested in advance of the hearing was, do you anticipate any challenges in implementing the policy or sustaining the policy going forward?
I think at this point, it's kind of hard to say, right? I think that we are obviously waiting for the state to develop the regulations, to understand, the level of stock of naloxone that they purchased, right, and how that part of it is going to work, and then we'll need to work with them because they're also responsible for the installation of the naloxone kits next and co-located with the AEDs. So we'll need to work with them to really determine what that is going to look like, and then separately understand the ongoing maintenance of the program, right? So, which is what we talked about earlier. If a dose is used at a site where it is, how do we notify the state that the dose has been used and needs to be replaced, or is the onus on the city to replace that dose, right? Like, there are some questions that we obviously have that we'll need to iron out with the state to make sure that not only are we ready to implement the program, but that we're ready to sustain it as well.
Yeah, that's really helpful. I mentioned earlier how this could and should work. Once we have naloxone available, this only really works well if folks are trained on how to use it. I'm curious if we've thought much about the training component and how we might be able to sort of fortify this to be an effective policy by having trained folks in these buildings that now have naloxone available. I want to thank you guys. You guys set up a training for the council after we held the first opioid hearing. I don't know if it was the one in this hearing or in public safety, but I want to thank you guys for setting up that meeting. Have we thought much about what it might take to add that training component as well?
Yeah, and so for city employees, there's actually already a naloxone training on Workday that city employees can take. I can follow up. I know that was a conversation earlier today. I can follow up with the number of city employees that so far have taken that training. I'm not sure if we'll be able to distinguish between which buildings they work in. I would have to work with HR on that to see if that's something that, and it's just literally that I don't know how it's tracked in Workday, whether or not it's just the employee or the employee in the building. But I know that is a program that is out there already for city employees to be able to go and Workday and take the naloxone training.
Yeah, I think having that overlap would be really helpful. If there's a way to encourage folks in these particular buildings that do end up with naloxone in them,
Right. Yeah.
I think that'd be an easy win for us.
Councilmember, Julia Roche, Legislative Affairs Director, Baltimore City Health Department. I actually do have that number on hand.
Oh, great.
The Workday training was rolled out in 2023. And I do want to emphasize we have been training city employees and residents since long before that.
Right.
But just since the Workday training was rolled out, we've trained 1,246 city employees.
Is it
to date.
1,246?
Yep. Thank you.
That's great. Yeah. I appreciate you guys. I think as we sort of fine tune how we implement this policy, I just want to make sure that it's effective. That's the whole point here. We want to make sure that we're being thoughtful about the rollout so that it can be effective, that folks are able to respond in instances where they come across overdoses. I'll tell you, in my personal experience, I kind of freaked out when it happened because there was none in the building, and the dose that I had in my car wasn't there. Now, someone else found a dose, but, you know, this could be a really important lifesaver, and then I think steps that we take thereafter are going to be really important. I think the conversation we'll have around buprenorphine, I think, will be a helpful one, and how to make that a reality. And then the step after buprenorphine to connect them to, you know, quality care is going to be helpful. So, Madam Chair, I want to thank you for calling this, and I'd hope to bring this back, and hopefully by then we have some more guidance from the state on what this might look like. And I'd encourage you guys in the in-between time to make a recommendation about the buildings we absolutely know we need it in, and to the effect that we might need more dosages in some buildings than 2. I would imagine that in some of our larger markets, 2 will not be sufficient, and so we might want to make that recommendation as well.
Thank you so much, Councilman Conway. Any more agency reports to share? Any more questions from committee members? All right, hearing and seeing none, Councilman, closing remarks?
Thank you.
Thank you so much, everyone. This hearing is now placed in recess, and we will reconvene on October 29th. Thank you all so much.